Hello, I am Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Today, let's try to understand what the causes of female infertility can be. Like I said before, and as you're already aware, about 40% of cases, the root cause could be the female factor. And there are various reasons why I say this. Let's try to understand what the causes can be. About 40% of female infertility could be because of ovulatory disorders. Now, ovulation means the release of egg. So maybe the egg is not growing properly, maybe it's not getting released properly, maybe it's not getting enough hormone stimulation to grow. There could be a lot of issues related to ovulatory disorders. But one of the main reasons for ovulatory problems and that associated with infertility is PCOS. About 85% of this ovulatory disorders patients are suffering from PCOS, polycystic ovarian syndrome. It's a very commonly seen problem in women nowadays, where the periods are irregular. There is, the ovulation cannot be tracked properly. So the couple is unaware when to try, when to have intercourse to get pregnant. So that's one of the reasons of ovulatory disorder factors when it comes to female infertility. Then there is the tubal factor. So when we talk about tubes, you have to remember that the tubes have to be patent, as in they have to be open. When the tubes are open only, the egg, when released from the ovary, can go and wait in the tube for the sperms to come, and then it is fertilized over there. So you understand the importance of the tubes. It is not just a hollow tube. It plays a very important role in pulling up the oocyte into the middle portion of the tube. Then the oocyte has to wait there for the sperms to arrive. Fertilization occurs inside the tube, and then after 3-4 days, the fertilized embryo then travels into the uterus. So it's very important that the tube be open. Some people have both tubes blocked. Some people have a single tube blocked. Some people do not have tubes from birth, congenital defects they have. So there are a lot of problems that can arise in the tube also. It could have been damaged by endometriosis. Suppose the endometriosis is very severe, the tubes could be damaged. Or if there was a previous surgery, then there could be scarring inside the tubes. You have to remember that a tube is a very interesting. Suppose this is a tube. There are some very small filaments inside the tube which are like cilia, they are like fingers. They help in moving the egg. So the motion of the egg inside the tube is by these fingers. So if there was a previous surgery, was it ectopic, was it endometriotic surgery for helping in endometriosis, there are a lot of surgeries that are performed in the tube also. Due to that, if this atmosphere was damaged, or if the patient had tuberculosis of the tubes, all these factors can affect the tubes also. So about 40% of female factors could be because of these tubal factors. Then we come to uterine factor. Uterus is a very important part, and about 5% of couples suffer from this factor as well. Now, when I say uterine factor, it could again be a lot of causes. It could be congenital anomalies. What if the uterus had a septum inside it, as in like a wall? What if there were two horns? What if they were, one side was growing, one side was not? What if the tube was connected to one side and the other side it was not? So these are all congenital problems that we will be talking about subsequently, but you have to understand that these could be one of the problems. Another problem is endometriosis, which is supposed to grow inside the endometrium or the uterus, is growing elsewhere. Then the atmosphere, the fluid that is accumulated and affects the uterus also, can bring down the implantation potential of endometrium. So the uterus that way is defective. Now, not only that, the uterus can also have polyps or fibroids. These are again very important things which have to be assessed for us to come to the conclusion that uterus is one of the factors. Then there is another 15% which is unexplained. Now, everything could be fine. The female side looks very good. Her periods are good. Her tubes are patent. Her uterus is good. And there is nothing that we can actually pinpoint in the woman. That comes under unexplained infertility. Even the hormone levels in such women is absolutely fine. So because it is unexplained, we are not able to put a finger on it, science has not gone until then, technology has not reached until there, we call it as unexplained infertility. If you are grappling with this condition where you're not able to conceive within 1 year since you've been trying, and you're less than 35 or you're more than 35 and you haven't gotten pregnant in 6 months, please feel free to contact us on the numbers that you can see on the screen. Take an appointment and come and meet us. Thank you.